thank you so much everyone for joining us to session 5 of our Aboriginal Health and Wellbeing virtual education series. My name's Katie Pryor. I work at the PHN as the Manager of Training and Development, and it's wonderful to work in partnership with the Public Health Unit to bring you these sessions. And thank you for joining us today. Just a little bit of housekeeping before I pass on. If everybody can just be on mute through the presentation, just so that we can all hear clearly. When it comes to the yarning time, though, please take yourself off mute or type in questions, and we'll have a wonderful discussion then. Could everybody please type their first and last name, your role and your place of work into the chat? That's just really so we can accurately record attendance. These sessions are endorsed with NUTSIWIP, so it's really important we get correct details for that. The educational component of this meeting is being recorded, but we will stop the recording for the yarning session just to create a really open space for everybody to ask all their questions. Slides will be shared after the session along with any resources that are discussed as well. And if everybody can please do an evaluation at the end, we always love your feedback so that we can use that on what we deliver moving forward. Now to you, Belle.
Thank you. Hi everyone, Belinda Tracy from Public Health. I am simply introducing the team today, of which one of me is on the Q&A, but our presenters today, we are blessed to have Kath and Kim come from the Public Health Unit. I hope everyone's got their trackies on and got their hair in styles, because you're going to be entertained today all about Q fever, and hopefully they'll bring a bit of pizzazz and jazz to the presentation as we go along. So I hope you really enjoy the session learning about Q fever and the vaccination. And Kathy will present first about the disease and give you a bit of an overview, and then Kim's going to talk about the vaccine and how we go about getting that. So that's really great. And then at the end of the presentation, Wendy is going to host the yarning session. So you'll get to know a bit more about the public health team and how we support you in your vaccination and disease education sessions. So I am going to be quiet now and hand over to Kathy Howell, where she can start this process. So enjoy the session, everybody. Thank you. Gwen, over to you for acknowledgement of country.
Yeah, everyone, good morning. My name's Gwen Troutman-Weir, Gummeroy woman living and working on Wiradjuri country. I'd first like to start the meeting by acknowledging the people of the areas that you guys are actually coming from today, as the traditional custodians of the lands on which we gather tonight as well. So I also pay respects to elders past, present and future, and acknowledge their continuing connection to land, water, culture and community. Also extend this respect and warmly welcome any Aboriginal and Torres Strait Islander people here present with us today. Thank you.
Thanks so much, Gwen, for that welcome. And for the introduction. I don't know how much pizzazz I can bring to Q fever, certainly not as much as Kath and Kim does. I would love to hear their presentation on Q fever, but anyhow, we'll give it a red hot shot. So Q fever, just before I start the presentation, has anybody in the room today had Q fever, or does anybody know of anybody that's had Q fever? If you don't want to, talk, we can just put yes in the chat. But yeah, just
or a thumbs up.
All right. Well, what we might do is, I've got a thumbs up. So, Judy. And we've got a yep. Got a few thumbs up.
So a couple of people.
Yeah, okay. So that tells me that, either somebody here has had Q fever or one of their family members or somebody that they know. And quite often you hear that. You hear people that have had Q fever or know someone that have had Q fever will know all about Q fever. We'll go to the next slide. I just wanted to give a bit of a background. So Q fever is a zoonotic disease, which means that it's passed from animals to humans. Rarely can it be passed from humans to humans. I don't, in fact, know of a case happening. Illness was first described back in the 1930s, and it was described in people working in the abattoir, and they were getting fevers, and basically it was coined query fever, hence Q fever. And an Australian pathologist, as well as an American scientist, worked together to isolate the bacteria that causes Q fever, which is known now as Coxiella burnetii. And the name of the scientist's surname is what makes up the name of the bacteria. And, you know, that was done to honour the work of those two scientists. In Australia, sheep, goats and cattle are the main reservoir. So that means where the bacteria is found. The bacteria is also found in the environment, which is contaminated by those animals. And, you know, the infection of other animals in the environment have been noted, and I've listed those animals there. The infection doesn't normally cause a clinical illness in animals, so that you don't see animals exhibiting symptoms the same as humans do. They may have a high abortion rate, might be the only, I suppose, indication that they might be infected with Q fever, but other than that, they don't exhibit any symptoms. Next slide, thanks. I just wanted to paint a bit of a picture for our area with regard to the Q fever notifications in the last 12 months. So these are confirmed or probable cases of Q fever. Whilst the numbers may not look like many, with the notification process, it's really difficult because sometimes people have been exposed before, so they're not counted as a confirmed case. And sometimes serology and diagnosis is difficult. So these are the cases that we know have had Q fever. And as you can see, predominantly it impacts males over females. The area that we're looking at down sort of the centre, the Warrumbungles, Burke, Cabone, Central Darling, Midwestern, Bathurst Regional, it affects and impacts those regional remote areas more so, where people are working and living on the land. The age group we see 25 to 64, predominantly you know, occupational exposure in that age group, and then the 65 plus, those farmers work until they drop. So, you know, they're actually quite elderly and still getting diagnosed with Q fever. The 15 to 24-year-olds, we don't see a lot of kids, but we do see that sort of 20 to 24-year-old, which usually are starting working on the land with their parents or maybe shearing. Next slide, thanks. So how do people come in contact with the bacteria? So the bacteria is excreted from the animal, and it's excreted during, you know, in the milk, in the urine, feces, and during birthing. And that's where the highest number of bacteria is found, is in the placenta of birthing animals. So just imagine if you're standing behind a cow, the cow's, you know, having its baby, the baby falls on the ground, and then the placenta falls on the ground. And just that action, basically, if it's full of bacteria, the action of the placenta dropping on the ground aerosolizes all the bacteria into the air. And if people in the surrounding area have their head close to that animal, which they would, and they inhale that bacteria, that's one way that people can catch Q fever. And it's probably the most common way we hear of people getting Q fever. And when they get it like that, they're normally sicker because they've had that large contamination of bacteria. It also survives in the environment. So once the cows had the baby calf, that placenta that's contaminated the environment, the bacteria then changes. It's the most amazing, extraordinary bacteria, and what it can do and how it can survive. So it then manipulates itself to survive in that environment. So it can last in the environment for up to 50 years. It's incredible. And it changes to adapt so that it can last for that long. And it just sits around, does its own thing until maybe a windstorm comes up and sweeps that bacteria into the face of somebody walking past, or into the environment where there's other bacteria that picks up and blows in the breeze. And that's another way. If there's lots of bacteria in the environment and there's windy conditions, that's another way people can come in contact with it. As I've just said, it's resistant to a lot of those things. Infection in humans usually occurs via breathing in the airborne dust and droplets from the contaminated bacteria. We'll go to the next slide. So infected dust may be carried on work clothing. Just before I go through this example, I just wanted to give you an example of how far bacteria can be blown in the wind. We had an outbreak, we didn't, but there was an outbreak that was notified in New South Wales, where there was an abattoir and it was newly built, and so the animals were outside more than they normally are. And so basically when the abattoir was being built, the conditions were really bad. They were in drought, that there'd been no rain, and the conditions were extremely windy. And up to 15 kilometres away from this abattoir, they had an outbreak of Q fever, and they identified cases up to 15 kilometres away from what we call the site of infection, which was identified as the abattoir. They had, I'm just going to say 15 cases of Q fever notified during that outbreak, and it just gives you an idea. If the conditions are right, that's one way that people can be infected. The other way, if you imagine that dusty condition, you're out in the, environment, working, shearing, doing all the things on the farm, you're going to contaminate your clothing. And we've also had cases of Q fever in, I suppose, the people at home washing the clothing. They've had no other sort of exposure or points of exposure other than doing the washing for their partners that come home from a dusty environment, and they've caught Q fever. It's not something that we see all the time. It's very rare, but it can happen. And, the infection, whilst I have not followed up or managed cases, there have been circumstances where it's unpasteurised milk, and the one I have seen is the tick bites. So we did have an outbreak of Q fever that we thought may have been related to tick bites. And as I indicated, person to person is extremely rare, and I've never known of a case. Next slide. So in the risk factors, what we look at for Q fever when we determined our data collection, one of the I suppose key points that we want to know is where they work, what risk factors they have, and there is quite extensive. I'm not going to read the whole list, but some of the key risk factors just in line with the abattoir workers. So they're our highest risk factor for Q fever. And really, if you're working in an abattoir, part of the employment should be that you get vaccinated, and you need to be vaccinated before you start work, not during work. So livestock and dairy farmers, farm workers, all of those risk factors that put you in direct contact with animals. And we have had some outbreaks of Q fever that have been carried by dog and cat, and they have been in the Northern Territory identified in some areas where when mum, especially in the cats where they give birth, because they are, give birth quite a bit, get pregnant, multiple pregnancies, and what they were finding was the kittens were, as they were birthing again in the placenta, people were getting Q fever from handling those birthed kittens. Again, it's not common, but it has happened, and outbreaks have been reported due to that. We had a case of Q fever in a veterinary worker who actually did an abortion on a cat, and after those aborted products weren't discarded properly without the vet having a mask or PPE on, they ended up with Q fever. So sometimes we've had Q fever in cases that have been mowing the lawn in a heavily contaminated environment from kangaroo droppings, and also in other agricultural businesses where there's lots of lawn mowing, but lots of wildlife preceding those, I suppose, activities, where there's been lots of sort of kangaroos in the area where they've left droppings behind, which has contaminated the environment. Next slide. So other people, we went through sort of that family members of those in high risk occupations, so handling their equipment, people living or near high risk industries, neighbouring stockyards, cattle, sheep, goats, visitors to high risk environments, so sale yards, meatworks. In fact, people shouldn't, and I don't think they're allowed to visit meatworks unless they've had a Q fever vaccination. People in regional and rural areas who, again, are more likely to breathe in contaminated environment after dust storms, and then the gardeners where they're in the environment again contaminated by animals' urine, feces, and birthing products in that sort of lawn area. Next slide. Symptoms. When I've interviewed, I'm going to say hundreds of people with Q fever over the time that I've been in the public health unit. And the majority of people I interview are men who work on the land. And these are men who have never been sick a day in their life. And they can remember if they had Q fever 20 years ago. They can name the date, they can name their symptoms, they can name everything, because they felt like they were going to die. Now, not everybody experiences these type of symptoms, but mostly when people are sick with Q fever, they describe being really sick. It's a sudden onset. It is like a severe flu. Typically I hear stories of, I had to wake up in the middle of the night and change my sheets because they were so wet. And that happens over a consecutive number of days. I was shaking, shivering, I couldn't get warm. My head, the headache, really describe a frontal sort of behind the eyes, just Panadol won't touch it, muscle pain, painful joints, and the intense fatigue, just trying to get up and do. They want to go back to work. They want to get back on their property, but they can't. And they just, really need to rest. And that's where when we talk to them and go through that, you really know when you're talking to somebody that's had Q fever. And some of the other symptoms along with those are really the ones I've described are the main symptoms. People might have weight loss because they can't keep food down. They're nauseous. They just feel sick. The sweats, the fevers make them feel sick. And other sort of involvement may be liver inflammation. I think this is on the next slide. So we might get an increase in liver function tests or inflammation around the area where they just feel, that there might be a bit of a sore sort of area in their side. Pneumonia, infection of the lungs, which is normally secondary. So they get that initial bacteria and they get unwell and then subsequently end up in hospital with pneumonia. The symptoms typically last 2 to 6 weeks. Can be longer. They do take some time to recover. And when I say recover, their acute illness, they may recover from it, but it may be months and months that they take to fully return to their previous, working day. So occasionally people develop chronic illness, and about 10% are sick with patients who are sick with acute Q fever go on to describe this yearly event where they become fatigued, similar to the symptoms, but not as severe every 12 months. It's quite concerning. Next slide, thanks. Chronic Q fever is characterised by an infection that persists for more than 6 months and can lead to complications like endocarditis, which is the damage to the heart valve, and post-Q fever fatigue syndrome. There's the thing with Q fever is the bacteria, as I said, it survives for 50 years outside of the environment. So imagine what it does when it gets into your body. It changes again to adapt to the environment. It's just incredible. There's no other bacteria that behaves like Q fever. It then adapts to survive and thrive within somebody's body. And the lungs is where the bacteria is absorbed initially, but through the process of the body and the infection, the infection can go on to spread to other areas of the body that are, I suppose, at risk of being in immunocompromised parts. So you've got hearts that aren't working properly, livers that aren't working properly, you've got areas that are just not functioning like they should. So the bacteria says, right, I'm going to go and hide in there. I'm going to survive in there for a while and I'm going to cause a bit of havoc, but I'm going to lay dormant until, a few years has passed, and then I might, cause a little bit more damage. And some of those organs that we see the damage in is the heart specifically. But I've heard of people with Q fever having cholecystitis and having their gallbladder removed and their gallbladders tested positive for Q fever. So it really just looks for an organ that isn't functioning properly and causes havoc with increased sort of disease in that area. And I've sort of covered that off on the last section there. So it's people with pre-existing conditions, and that's where the bacteria finds, it just finds those areas and attacks those areas. So I will reiterate this further on in the slides, but it's so important that if people or any of your mob or the people that you're dealing with in your daily work, if they're thinking that they could have Q fever, that they get that investigated, and if it's positive, that if they're put on treatment, they finish the treatment, because we know that completing treatment gives people the best advantage that they don't end up with these chronic conditions. So that's just a really key point that I want to push during this education session. Next slide. and it can be difficult to diagnose. So if someone's got a at-risk condition, an at-risk, occupation, or they live on the land, or they've had helped a mate out on the property, birthing, if they've helped fencing, if they've been shearing, if they've got a risk occupation, then their percentage of being exposed to Q fever is so much greater that they need to be tested. And you know, not all doctors know about Q fever, especially doctors coming out here from the city. Now, some patients have told me they had to ask and request testing. And you know what? That's what we have to do. We have to empower the people to know when they need to say, hey, have you thought about Q fever? If they've got a known at-risk occupation, animal contact, and they've got the symptoms, flu-like illness with, you know, those night sweats, headaches, then just, hey, have you thought about Q fever? Can you give me a test for Q fever? Do you know, talk to the doctor and ask that question. And it may be that you just prompt that doctor to do a simple blood test. And unfortunately, there's some tests that come back negative. It's been too soon, and they need to go back for second tests. And if they don't know that, then some people go away and never get that second test. So there's the diagnosis of Q fever can often be difficult. And again, having that discussion with the doctor, mate, do I need another test? Do I need a second test just to confirm that this first test was right? They're the sort of things that are really important to know, that you might need 2 tests to get the diagnosis for Q fever right. But yeah, and there's one important test that we always ask, and it's called PCR, and that's a shortened term for a long scientific name. But PCR testing is done for a lot of, you know, bacteria, viruses, and it basically is testing for the disease that's present. So it's testing for live bacteria, live virus, and when they do that, it's confirmed. But quite often doctors just, they don't know that the test can be done, they don't order the test. But the other complication is that it doesn't stay positive for long. So if someone gets infected with Q fever and they don't go to the doctor, or they don't get tested for sort of 7 days later, then that test may be negative. And that's why it's important that they get another test, so that they, you know, confirm that the result is, you know, not Q fever, or it is Q fever, and then that can be treated. Next slide. So if it's confirmed and if the suspicion is high, then they need to be treated with antibiotics, and doxycycline is the antibiotic that they treat Q fever with. The dose is usually two tablets a day for 10 days. But like I said, you know, when you're talking to your patients, you've got to make sure that they know that they've got to complete the course of antibiotics, because that's what will kill the bacteria. And that's what will help prevent any further infection or complications with those other things that we talked about. So just having that conversation is so important, and people may need to be in hospital because they need that support to help them recover from this infection. Next slide. Some of the things that, you know, you can talk to your people about is to reduce the risk of infection. Vaccination, this does not replace vaccination. So wearing a properly fitted P2 mask when mowing areas of high vegetation, or where there's been high numbers of livestock, or as I said earlier, kangaroos. Washing your hands thoroughly in soapy water after coming into contact with those high-risk animals, if you've been working with those animals, covering wounds with dressings, and washing the environment where those where you've been working with animals. That's more to do with I suppose, shearing sheds, places where those environments would be heavily contaminated. Next slide. So removing wash and washing dirty clothing, overalls and boots worn during high risk activities outdoors, you know, that again is important. Shaking your clothes out outside, having a mask on when you do that. Avoid taking these items home to reduce the risk of infection. So maybe wearing overalls, taking those off to, you know, protect those clothing underneath, but more to the point, putting them straight in the washing machine, in, you know, you doing that, not giving it to somebody else to wash. And if you do take them home, pop them in a bag and put them straight in the washing machine. But as I said, this should not be considered a substitute for vaccination. Next slide. I think that might be going into Kim's talk. There's just I suppose a bit of an overall view of the risk. 4 out of 5 Aboriginal people who get Q fever were male, and that's really what we see in our area. And those males work in the shearing sheds and they're contracting. So they're working in many different sheds across the LHC and they don't know or haven't been told about vaccination. And as it's, you know, it's not a good illness, and especially I think for young men to be infected with Q fever, they can go on to have, you know, chronic Q fever if they have those risk factors and if they're not treated appropriately. So the message is, please, if you think it's Q fever, if you've got those risk factors, if they're exhibiting those symptoms, they've worked in a high risk area, they haven't had a vaccine, think Q fever, get tested, ensure that that testing has been redone, so that convalescent serology to confirm, and then ensure that that treatment is taken and completed. But I'll let Kim talk about vaccination, because really this is the only prevention that we know works. Thank you so much, everybody.
Thanks, Kath. That was great. Okay, can everyone hear me? It's all good? Yeah, oh, that's excellent. Actually, that just really brought back memories of when I can remember my father being very sick with Q fever when I was a young girl. And yeah, I definitely can remember that very clearly. So the best attack is prevention. So let's move to the next slide. Okay, so who is recommended to get Q fever vaccine? So next slide. So adolescents and adults over the age of 15 years who are at risk are recommended. So I think we've touched on this before, but definitely those abattoir workers. And I think Kath even mentioned, like, I think you can't even go to an abattoir now unless you've had the vaccine. Farmers, stockyard workers, shearers, the animal transporters, vets, vet nurses and vet students. So we can clearly see why they're recommended, you know, because they'd be going to those births. Professional dog and cat breeders and pet food manufacturer workers. Next slide. Ag staff and students, the zoo workers, animal refuge workers, people who cull or process kangaroos or camels, the lab workers who actually handle the bacteria, and other people that are exposed to high-risk animals. Next slide. So the Q fever, to get a Q fever vaccine, it's not like your standard vaccine. So you can't just rock up to your pharmacy and say, can I have a vaccine to Q fever? There's steps involved in that. And why there is steps, because if people have the vaccine that have been previously exposed to Q fever, you can get very sick from the vaccine. So we definitely don't want that to happen. So the steps of getting a Q fever vaccine is you must have a blood test and you must have a skin test prior to having the vaccine. So a comprehensive assessment and health history also needs to be taken as part of the pre-vaccine screening. So the blood test will test for immunity, and the positive skin test involves a skin reaction at the site of the test. So the two steps, the blood test and the skin test, that is looking for people who have previously been infected with Q fever and aren't aware of it. Next slide. So Q fever testing is usually done in the right arm. And why is that? It's because we don't want to confuse it with TB testing and vaccination, which is done in the left arm. Skin test location should be clearly documented so that when reading the skin test a week later, there is no forgetting where it has been done. So a small amount of the skin test is injected into the right forearm just under the skin. Next slide. So with a skin test, you mix up about 15 mils, which is approximately 30 doses. So once mixed, it is only good for 6 hours and then it must be thrown out. So for this reason, that's why often, someone will want to book to have a Q fever vaccine and you've got to wait till certain days, because you can see why now, because they mix up a whole lot and it's only good for 6 hours. So they want to run a clinic and do more than one person because we want to get bang for our buck. So often GPs who are trained at administering the Q fever vaccine, they'll say they'll have appointments and you must come on that day. Next slide. So a positive skin test is any reaction or lump at the site of the skin test, and it's measured 7 days after the skin test was administered. So the skin test shouldn't be done on people if there's no available vaccine, as by the time the vaccine is available, the skin test result may be outdated and unreliable. So what that means is when you book to have a Q fever vaccine, you'll have 2 appointments. So you'll have one appointment to get the skin test done and organise a blood test, and then 7 days after that is when you go back and the GP will measure the skin test, look at the blood test result and work out whether you're good to go to have the vaccine. So it's no good doing a whole lot of skin tests on people if the vaccine's not available a week later, because then, so say if you did the skin test and a week later, we don't have any Q fever vaccines, we have to start the process again, because if then they've got to wait a month to get the vaccine, they might have been exposed to the virus and we don't want them getting sick from the vaccine. So I hope that makes sense. So it's definitely, you have to, that's why they're very strict with, you do the skin test and then a week later, the vaccine. Next slide. So the Q fever vaccine should not be given to anyone that's had an anaphylaxis after a component of a Q fever vaccine, anyone that's had anaphylaxis to eggs, anyone that's had a history of lab-confirmed Q fever and have other medical documentation that supports a previous diagnosis of Q fever. Because if you've had Q fever and you have the vaccine, you can get very sick. So we don't want that. That's why we're doing these steps. Next slide. So who can't be vaccinated? So if someone's had a positive blood test result, and if they've had a positive skin test result, or have been vaccinated against Q fever previously, are immunocompromised, because there's no information is available on the accuracy of skin testing or the efficiency and safety of Q fever vaccine in people who are immunocompromised. And the safety of Q fever vaccine has not been established in pregnancy, therefore it's not recommended for pregnant or breastfeeding women. So these are the people that shouldn't have the vaccine. So when to vaccinate? Vaccination should only be given to a person that's had a negative blood test and the negative skin test. And then the vaccine is given subcutaneously, usually in the upper right arm. Skin testing and vaccination should only be done by experienced, appropriately trained providers. Not all GPs can give the vaccine. And currently there is a Q fever vaccine shortage, so priority is currently being given to high-risk populations. Next slide. So sometimes, of course, everything in the world is not black and white. So sometimes we get some inconclusive pre-vaccination results. So sometimes the testing comes back, you know, the blood test is very weak positive and only slight lump under the skin. So in this case, both tests should be repeated 2 to 3 weeks after the first test. Patient history is very important in this situation. If they describe Q fever type illness in the past, they shouldn't be vaccinated. And if there's no history of Q fever type illness, patient can be vaccinated with 2 smaller doses of the Q-Vax after consultation with their doctor. Next slide. So that's what the vaccine looks like. That's the skin test is on the left and the vaccine on the right. Next slide. Okay, so where to get one, which is a great question. It's not available at pharmacies and it's GP only. So there's been big changes in the Q fever register. So prior to April of this year, we had a Q fever register, and then they've decided that, okay, record of vaccination will go to air. So since April 2024, all Q fever vaccines are recorded on the Australian Immunisation Register, which I think is a good move because more people can have access of the Australian Immunisation Register. Past Q fever vaccine records may be available from the Q fever register, but you have to call the public health unit for assistance in that. The Q fever register that we used to use prior to April 2024 is closing in June 2025. And so previous vaccine records need to be downloaded before then. So it's sort of going to be a pretty tricky grey area for Q fever vaccine providers. So, and because we know that sometimes people aren't very good at keeping their records. So, yeah, it's going to be a little bit tricky. Next slide. What advice should you give? So I think after hearing Kath's talk about the actual disease and the symptoms, I don't think I ever want Q fever. So I think it's all about you guys talking to your community about Q fever vaccination, and definitely if they work in those high risk areas, you know, I would be really encouraging them to get a Q fever vaccine. So I encourage people to talk to their GP or employee about the vaccine. Q fever vaccine, it's not funded by the government, which is a barrier to many at-risk people. So as you know, you need 2 appointments, so 2 consultations, and it's about $150 for the vaccine. Fortunately, a lot of employees in those high-risk areas will pay for Q fever testing and vaccination as part of their staff health program. Next slide. Oh, we're at the end. Question time. Hello, is anyone?
Does anybody want to ask Kath and Kim a question, or if you're not happy to unmute, just pop a question in the chat.
Can anyone hear me? My camera's mucking up.
I can hear you, Belle.
Oh, good. I thought I might jump on and just help. So let me have a look in the chat because I think something just popped up in the chat. Is hang on, one vaccine lasts forever? Asked Pam.
Yes.
Yes, it does.
Because they don't actually, because that's a great question. Actually don't want you to have another one, Pam, because, you know, it makes you really sick. So, yes.
Once is enough. Is the vaccine a live vaccine?
Belle, I should know that answer.
We'll double check.
Yeah, I should know that by the.
I don't think it is.
No, I don't think it is either.
I think it's attenuated. So
yeah.
So no is the answer, but I will double check.
Sorry, you guys just stuck me. Yeah.
That's okay. This is good. Good questions. All right. Is there any point getting a vaccine if not needed? I suppose it's looking at those risks, isn't it? that can't be
Yeah.
brought up.
Well, definitely at the moment, if there is a shortage. So do you mean, whoever asked that question, like someone that doesn't work in a high, like doesn't have high risk? Yeah.
Debbie asked it. Yeah.
Oh,
That's what I was thinking. If you're not.
Yeah, I
working
don't think, because there is that shortage, Debbie. I think, they're really just concentrating on those people that really need it.
Absolutely.
Yeah.
Is it the only GP that can give the vaccine, or are authorised immunisers able to give it?
Only GPs, but not all GPs. Like, you have to have special training.
So an authorised immuniser can't go and do the special training, especially out here in remote areas where GPs are rare as hen's teeth. And
They've actually, it's Kathy here, they've actually changed that just recently to allow GPs. Basically, a GP can give the vaccine, but there is an online education session that they need to complete. Once upon a time, they used to have a qualification to give it, but that's no longer the case. So if the GP's happy to give the vaccine, they will, with the practice nurse, provide those clinics. And we're seeing them more and more, especially in the areas where we've got, circulating Q fever cases. So I think the GPs are responding to those cases that they're testing and thinking, okay, we need to offer vaccine here. So along with the package that's offered through the remote GP training sessions, they can give that vaccine.